Why does type 2 diabetes cause stroke? Imagine your blood vessels as the highways that carry blood and oxygen to your brain. When you have type 2 diabetes, these highways face multiple challenges that can lead to a stroke. People with type 2 diabetes are about 1.5 to 2 times more likely to experience a stroke than those without diabetes. This risk grows the longer someone has diabetes. The main reason is that high blood sugar and related metabolic issues cause damage to blood vessels and the heart, disrupting normal blood flow. One key problem is atherosclerosis, which is the buildup of fatty plaques inside large arteries. High blood sugar levels, insulin resistance, and other metabolic abnormalities promote this plaque formation. As plaques grow, they narrow and harden the arteries, making it harder for blood to flow freely. Sometimes, pieces of these plaques can break off and block smaller arteries in the brain, leading to an ischemic stroke. Diabetes also causes chronic inflammation and oxidative stress, which damage the lining of blood vessels called the endothelium, speeding up this process. Small blood vessels in the brain are also affected by diabetes. The tiny arteries can become stiff and dysfunctional, leading to small vessel disease. This can cause lacunar strokes, which are small but serious blockages deep within the brain tissue. Damage to these small vessels can also contribute to cognitive decline over time. Factors like high blood sugar, obesity, high blood pressure, and inflammation all work together to harm these delicate vessels. Diabetes also increases the risk of heart problems, especially atrial fibrillation, an irregular heartbeat that can cause blood clots to form in the heart. These clots can travel to the brain and cause a cardioembolic stroke. Diabetes-related changes in the heart, such as fibrosis and structural remodeling, make this more likely. High blood pressure is common among people with type 2 diabetes and is a major contributor to stroke risk. Elevated blood pressure damages blood vessels and worsens the effects of diabetes on the vascular system. Obesity and abnormal cholesterol levels, known as dyslipidemia, further increase the risk by promoting plaque buildup and vascular injury. High blood sugar levels also cause oxidative stress and inflammation, which damage blood vessels and impair their ability to dilate properly. This endothelial dysfunction makes blood vessels less flexible and more prone to injury. When blood flow is compromised, the brain becomes vulnerable to strokes, especially during episodes of high blood pressure or blood vessel blockage. Managing these risks is crucial. Controlling blood sugar, blood pressure, and cholesterol levels through medication, lifestyle changes, and a healthy diet can significantly reduce the chances of having a stroke. Regular physical activity, quitting smoking, and maintaining a healthy weight are also important steps to protect your blood vessels and your brain. In summary, type 2 diabetes causes stroke through a combination of accelerated artery hardening, damage to small blood vessels, increased risk of irregular heart rhythms, and metabolic disturbances. These factors work together to impair blood flow to the brain and increase the likelihood of blood clots forming. It's essential to work closely with healthcare professionals to manage these risk factors and prevent stroke. Always remember, individual health conditions vary, so personalized medical advice is key to effective prevention.